Building a family can be a complicated, messy, lonely, and sometimes heartbreaking process. But you don't have to navigate this challenging journey alone.
Welcome to the All Paths podcast, where we support and celebrate all of the different ways there are to try to grow your family. We are your hosts, Kate and Emily from the nonprofit organization All Paths Family Building. And today we're talking with Dr. Natalie Crawford about her own journey and her work. Dr. Crawford, thank you for joining us today.
Thank you so much for having me. I'm really excited to be able to talk to you guys today.
Well, we're excited to have you and probably maybe a little more nervous than our typical podcast episode. No, we feel very comfortable with you, but you're very awesome in this particular space, among others. So before we get into talking about your own family building journey in more detail, we'd love for you to just introduce yourself to our listeners.
Absolutely. So I am Natalie Crawford. I'm a fertility doctor. So I'm a board certified OBGYN and REI. I practice in Austin, Texas, and co-founded a practice called Fora Fertility 5 years ago, which seems crazy at this time. And this is just a small, really personalized practice, just thinking that fertility is such a, let's just say, difficult experience to go through. And my partner and I really felt like we wanted more control as physicians over what the patient experience was going to be, because we can't always control the outcome, even though we try our hardest, but we can control the experience and what is happening on the way to that outcome. So that really led us to start Fora. I also have a side passion, largely out of my own experience, which we'll talk about, which is about education, about fertility and hormones and natural fertility, especially thinking that I saw patients in my clinic just really late, and I felt like I was seeing people who lacked fundamental knowledge because they were never taught. And it felt like such a mountain to climb to tackle some of these topics when we just had to get back up to the basics. So I've been on social media over a decade talking about fertility. I host the As a Woman podcast and have a YouTube channel. And my debut book, The Fertility Formula, talking all about these topics. I know it's finally being born in the spring of 2026. And it is
So exciting.
Oh, y'all, I've been working for so long, 5, 6 years, trying to get this exact book into existence. And it's so interesting just how the world is. We were talking about this before we started recording, that right now everybody's so into this very catchy, very short content. And I feel like we're seeing this circular action where people are now really into podcasts and books and wanting that deeper connection. But I tried to get this book into existence back in 2018, 2019. I had a book agent, I had a proposal, and shopped it around and was told nobody wants a book on fertility. Nobody wants to talk about such a depressing topic. Nobody wants to be told that lifestyle changes could be helpful, that this was not a book that like the world wanted. And I kind of shelved it, but refused to believe it. Said, I'm just going to keep on trucking on the internet and we'll revisit this when the time sees right. So it seems like one of those things that just, they wanted me to change it to have it look different. I was like, no, this is my book. This is what I want it to be. So very much like anything that we really, really want, sometimes we have to be the, one driving that ship saying, this is the way it's going to be. And if the time isn't right now, we'll kind of wait until it is. So finally it'll be coming. And that was a very long introduction, but I'm very excited to be here today.
Well, thank you. And I mean, I think I can speak for the fertility community. I don't know why I just made myself the representative of that, but I'm very glad that you did not give up on that dream for your book. It's going to be amazing. Very excited.
Thank you. Thank you. That means so much to me.
So thank you so much for sharing a little bit about you. I'm sure a lot of our listeners are already very well aware of who you are, but they might not know kind of the story behind the Instagram celebrity or the YouTube celebrity that they rely on for a lot of their fertility education. So can you tell us a little bit about your own journey to starting a family? Where did that all begin?
Well, probably one thing that most people can relate to is it really hit me out of the blue, despite being somebody who is in this field. I always wanted to be a mom. I always wanted to be a doctor and a mom. So it wasn't something that I wasn't sure of. It was always a goal, but it was something that when we'd have these conversations, just said, oh, the time is not right. I'm chasing these other dreams. I was on birth control for a long time and really naively thought I would stop the pill and get pregnant very quickly. And in residency, so at the end of my OBGYN residency, we started actively trying and I started having pregnancy loss. So I remember after my first pregnancy loss, being so clinical about it and telling my husband, oh, it's okay. 1 out of 4 pregnancies end in a pregnancy loss. It's chromosomal abnormality. Probably we'd rather it in this way than, I gave all the same things that anybody who's ever had a pregnancy loss has probably heard before. I just spouted them out and then got pregnant again. And then this one was extremely traumatic for me and really started changing how I viewed what it's like to be on the other side of the table because I was more pregnant, had stronger symptoms, I was further along, and I was the senior resident in charge of labor and delivery. So I trained at Parkland, which is a huge OBGYN program. And while I was training there, every night, one of the fourth year residents is in charge of running labor and delivery. And it was my night, and I was running around, and I started cramping and bleeding and started miscarrying in the middle of a shift. And it was, I'm older, so it's a different era. My daughter's now 11, and so this was well before then. But this definitely wasn't the time where you would take personal time from work. It was, tough it up, buttercup. Like, you had to do your job. That was what I was there to do. So nobody knew I was pregnant. Nobody knew I was miscarrying. Really had to stuff that all down, get through the shift and deliver other people's babies, manage labor, do my job. And then, I remember just sobbing in the car on the way home and going to my doctor. I called and was like, can I go in on my way home? And, hold that glimmer of a hope that like what I knew was happening wasn't really what was happening. And I was so dismissed. I was very much like, it'll happen. Don't worry about it. Just relax. You just live a stressful life. Just keep trying. And that was really hard to sit there with somebody who I felt like I trusted and I really needed this help and advice. And then I also felt very stupid, meaning I have all these questions, but I'm an OBGYN. I'm about to graduate residency, and I don't have the answers to some of these questions. And really started realizing that I had to be a bigger advocate for my own self and I had to learn what I wanted and I was going to have to push the needle here, which was very eye-opening and has always changed how I approach patients now because I know that when the words we say as a physician, they matter. There are words that my doctor said to me, when I saw a doctor after I went on and had a third loss. And that time I switched doctors and I heard something extremely impactful, just saying, walking me through, we're going to do testing and I may not be able to find an answer, but I'm going to try. And, when tests came back essentially normal, which is so hard to get this unexplained diagnosis, I was told, look, there's nothing here that tells me this isn't going to happen for you. And even if I don't have all the answers, I believe this is going to work and that one day you'll be a parent. And, I played that over my mind over and over, over the next year when we were still struggling. So it really showed me how we approach humans with compassion and the words that we use really matter, just kind of being on that other side. And I think this is an experience for so many people who have infertility is that it's your first real medical problem. You go to the doctor for preventive care before that. And this is the first time you may be sitting on the other side of the table with a problem that you need help solving. It's not just a easygoing visit, an annual exam, and really enlightened me to how we should approach people. I went on. This will now be the entire podcast because I am taking so long just going through.
No,
the
this is
story.
perfect.
I went on. We moved and went to fellowship, and then had an ectopic pregnancy. And I was really like, I was so over it by this point, right? I've had all these pregnancy losses, had an ectopic pregnancy, had to get methotrexate, which is, if anybody's ever gotten it, it's just terrible. I felt terrible. Had all this test that was normal, and essentially was told, we don't know what's going on. IVF is probably the best option. But you're the clinical fellow, so you're the IVF fellow this year. So you're going to have to probably wait until after this year because, you can't be going through IVF if you're doing IVF. And I said, okay, fine, fine. This is this job, this doctor job. I was so happy to be in fellowship. I was like, fine, this is what I'll focus on. But where I drew the line in the sand, because in REI fellowship, it's 3 years in length. You've already done 4 years of OBGYN. you do a year and a half of clinical work, and you do a year and a half of research. And I said, you know what, though? I'm going to do research on natural fertility, like why some people can get pregnant and why others can't. The questions that I have about my luteal phase and my cycle and vitamins and toxins that everybody kind of was dismissive of, especially at that time. And most fellows do an IVF project because it's a very controlled environment. It's easier to see an outcome. There's IVF is what so many people, really do afterward. So most fellows are doing IVF, some type of lab project. And I went to my fellowship director, said, I want to study natural fertility. And they were like, that's going to be a hard project because in your boards, you have to do a thesis defense. You have to write a thesis. It has to be accepted and published. You have to defend it. And they were like, no, I don't think that's a good idea. And I said, no, this is what I want to do. This is what I'm passionate about. They said, well, you're going to have to get a master's of clinical research if you want to do that. And I said, great, sign me up. Like, sign me up. So got that concurrently with my fellowship. And what my fellowship mentor was Ann Steiner, who is a brilliant epidemiologist looking at natural fertility. And really started diving into all of these things, but vitamin D levels and ovarian reserve and the luteal phase and environmental toxins. And what struck me so profoundly was how just like hidden, talked about, but not connected, was the fact that inflammation was in all of these different papers in some way about how this can help inflammation. And that's the hypothesis for why vitamin D was helpful. And endocrine disrupting chemicals also cause inflammation. Yet, as a physician at that time, we only were really talking about inflammation on the disease pathway. Endometriosis causes inflammation bad. PCOS can cause inflammation. But there wasn't this kind of overarching, this can be harmful to egg quality or sperm quality or your ovulatory process, your HPO axis. But I really started saying, gosh, the research is talking about inflammation. I'm not talking about it in my clinic. We're not telling people to change things. I mean, honestly, the message was very much, you can do what you want. Yeah, living healthy is good. We're going to be doing IVF was the message that I got and the message that I was mostly giving patients. And so I said, I'm going to be my own N of one study. Came home, I remember getting rid of all the plastic and all the Teflon and saying, we're not eating now, I'm gonna start cooking. And you really just started changing how our life was with the idea that the research I'm going through, the research I'm doing is saying that inflammation is bad. What is inflammation? What causes me to have inflammation? How can I fix that so that when we do IVF, I have the best eggs possible, right? With the idea that kind of, even in IVF, there's a lot of unknowns, but you're only working with the eggs and sperm that people are giving you. So that really became my mentality. I'm an all or nothing girl. I'm going to go in and make sure that we're checking these boxes so I'm not worried about it. And when I really started diving in and tracking my cycle and looking at, inflammation signs and luteal phase, I remember telling my co-fellow, I think my luteal phase is short. And she said, well, let's take some Clomid while you're waiting. It's not going to hurt. And after, months of anti-inflammatory changes and then doing Clomid, I got pregnant with my daughter and stayed pregnant. And, decade later, truly, I ended up getting diagnosed with celiac disease, which is interesting because, when I started listening to what makes me feel inflamed, gluten was one of the things that I cut out. And I would have told you there's a 0% chance that I'd had celiac disease because I ate gluten all the time. I wasn't something that had this profound reaction to then. But it definitely was something when I was eating anti-inflammatory because I do think there's some general guiding principles. And then overall, though, we have to learn how to listen to our body. Women especially have been gaslit, dismissed, that we now dismiss ourselves. And we have to start saying, hey, this is how my body should be working. And this is a red flag that for me, this thing isn't working well. And so when I started really listening to that, it was, lots of fruits and veggies, and gluten was not in the list. And it was interesting because when I got pregnant with my son, naturally, postpartum, my kids are really close in age. I was still eating that way, right? So I still wasn't having gluten. I was, still in this stage where I was eating lots of whole foods because also I felt immensely better not having this inflammatory burden. And that to me was really changed a lot of wanting to talk online, wanting to talk in other spaces. And of course, I talk about all these fertility topics, but what I think has been not talked about enough until now, I do think we're seeing the tide change, is how we do have more control than we've previously been given kind of the autonomy to do so, saying, these are different things that can cause inflammation. This is what inflammation does. And I also think that this narrative that, some people are lucky and get pregnant and some people have bad luck and have infertility feels harmful because it feels more out of control. And luck is something you have zero control over. And I'm not saying I caused my infertility or my pregnancy loss, but there was a time where I was not in control of the situation and I was a passive person. And taking charge of it said, I'm going to learn about my body. I'm going to track my cycle. I'm going to start to advocate for myself. I'm going to optimize what I can. And so there's this idea that taking control of it doesn't mean that everything's always going to go perfect, but it means you're controlling what you can and you're more an active role in the process versus how I was in my first few pregnancies, just kind of expecting the system to work for me, expecting that I would get pregnant because most people do, expecting that my doctors would do what I needed them to do and would handle it the right way. And so to me, that really is something that I'm big on advocating for, is that even if we can't always control what's happening at the very end, as I said earlier, we can control the journey. We can play a bigger role in what's happening to us. And a lot of that starts with educating and understanding our own body. And now I have two kids, and my youngest is about to turn 10. So that's how long ago all of this was for me.
Well, I really love that, everything you shared, and also really appreciate, you going into detail about that, because I do think it is systemic that our education about our overall health and our reproductive health in this country is still so flawed and inadequate. So all of us don't know enough about our overall health, what makes us healthy, what makes us feel healthy and feel better. And certainly we don't learn enough about our reproductive health. And then that just continues into, adulthood. And then when those of us who want to grow a family have problems, you're really dealing with that lack of information and trusted resources that you should have had all along.
I was just going to say, yeah, I agree. And I think something else that, we don't learn about our reproductive health, we don't learn about our health, but also a lot of it gets dismissed when we do ask questions as well. So it's a double-edged sword. And I've even had other fertility doctors in the past, I feel like the wave has turned. Say, I don't know why you're wasting your time talking about diet or lifestyle changes. People are going to do what they're going to do. And I've long had the belief that it's not my job to control what other people do, but it's my job to tell them the why. And if you tell somebody the why and help them understand, there is such a greater adherence to positive change for their health and their fertility because now they understand. But when we make this presumption that somebody doesn't care or they're not smart enough to understand, or we just tell them to make a change without that background information, we're not really arming them with what they need. And I think
Yeah.
that's been holding women back as well, saying, I'm just going to be very paternalistic and tell you what to do without any of the whys, doesn't really spark that desire or that need to say, I'm going to make this change now.
Yeah. And to me, if you know some of those things and you choose for whatever reason not to do them or they don't work for you, that is fine. But to me, the tragedy is the not knowing. That is
Yes.
unacceptable. And that's what I think you have done a lot to change, and
Well, thank
others.
you.
Yeah.
Yeah, it is a tragedy. And I do think it's right. Like, there's no one right or wrong choice for everybody, but you should be given the opportunity to make the choice. And you can't make decisions on data you don't know. So you've got to know the information to then make the educated choice.
Yeah,
Oh my gosh, we
100%.
could talk for 2 hours. Well, oh, because I'm like
It's
so
like
many
we're
of
bumping everything is
no,
happening.
forget it. We're clear the schedule. No, just kidding. Just kidding. We know you're busy too. But just one quick question I
Yes.
have, and I'll try to remember the other things that are in my brain. But so you were already on the OBGYN path in your medical education, but were you already planning to do an REI fellowship, or did your own experience change that trajectory?
No, I was already going to be an REI. It's a
Wow.
very long journey.
Cool.
I started doing REI research. I guess part of this background is doing the natural fertility research is I did work in a lab and, worked with pituitary cells for 3 years to do research to help get into fellowship because it's very competitive. There's only 40 to 50 spots across the country every year. So I started doing that research and wanting to go into infertility back in like my second year of residency. Extra background you didn't want or need to know is I actually did a year of emergency medicine before I switched to OBGYN. I just loved medicine. I loved diagnostics. I love that little clinical picture and challenge. And very quickly in my ER residency realized I have a selfish need to be a doctor that connects with people and follows them through a problem and a story. And I could see the writing on the wall for emergency medicine, even though I loved so many aspects of it, that I would burn out and leave because I wasn't getting what I needed from that job. And that I finished that year and then had to start over in OBGYN. And because of that knowledge, felt very convinced that I wanted to be more on the end of somebody's problem spectrum, right? I didn't want to have to say, okay, well, now you have infertility. I'm going to send you to somebody else. I foresaw the same
Right.
problem. So that really was eye-opening to me very early on. And I'm a big believer. If something doesn't serve you, leave it, quit. Life is short. Find something that is going to spark love. And that's from your job, even if you have a doctor relationship that's not working, leave it and go find somebody else. That staying stagnant can be extremely harmful for us. But when I restarted in OBGYN, I really thought, okay, I want to be on the end of the spectrum. And those same nerdy things that I loved about the ER, the diagnostic puzzle and how the pieces fit together. I mean, all right, we're very nerdy. But there's also a lot of procedures and hands-on things that happen with IVF, and the tech is so cool. So I worked really hard to get into REI fellowship, and we didn't even start trying until I was like in interview season, having my losses during that interview match and all of that. And I remember many times being like, I'm going to be an infertility doctor who can't fix her own infertility. I mean, that's how I felt, right? It's like this double failure of how is this what I'm passionate about going to be my life work? Yet here I am, not even knowing what's going on with me. It felt so ironic in all the worst ways.
As we always say, like, we hate when we don't want anyone to go through this, obviously. And so when we hear that someone has struggled themselves, we hate to hear that. But at the same time, I will say, I think knowing that a provider can relate is really helpful for patients. I think it creates a trust that, which isn't to say there's not wonderful doctors that didn't personally go through loss or
Yeah.
infertility, because of course there are. But we know several who unfortunately have this in common with their patients. And I do think it is a strength and it is something that creates a lot of trust in our community because there is so much giving up of control and not feeling like you can really necessarily trust this person or trust the universe sometimes. So it is nice to have that bond with your physician, I feel like.
I mean, I'm an open book because I do think that connection, I'm asking somebody to open up and be extremely vulnerable with their biggest fears and everything that's happening in their world and trust me in a very short time. And so I've always been really open about what I went through and just relating when I can and just knowing, I mean, like every patient I see who has a pregnancy loss, which unfortunately still happens, I hug them and I say, I've been in your shoes and like, I know it's terrible, right? Like we'll meet and we'll go over a game plan, but right now, I know there's nothing I can say except big hugs. I'm thinking of you. This sucks, grieve it, and I get emotional every single time. But I do think it's so interesting because the world is so different now than when I was training. And even when I first started on social media, I got so much hate from our field and my colleagues from sharing my personal story at first, saying that, you shouldn't be that close to patients. You got to keep your personal life and your professional life separate. And I really stood firm and I'm a physician, but I'm a person first, and they're going to trust me more if they know this about me. But it was not received positively. It's kind of shocking now.
Thanks. Well, I mean, again, community rep for Summers. I'm really glad you ignored that. I mean, there's a reason that so many people have connected with you. It's because you are not just that, like you were describing that, like patriarchal, I'm going to tell you what to do without giving you any sort of explanation or any insight as to like how I came about this knowledge or me showing any emotion towards you when you're going through this. Just like, this is what I said to do. So do it.
Yeah.
That doesn't work. And you are living proof that that doesn't work. That the flip side of that, that sharing your story, taking the time to explain this is why these things are being recommended. That's what works. That's the piece that patients are looking for.
Well,
Yeah.
thank you, Emily. You're the best community representative, I gotta say, right?
I'm like, Emily speaks for me for
I was
sure, as well as the broader
I,
community.
we'll give a
And
shout out to the celiac community too while we're at it, because I was
yeah.
like, oh, this could have explained
Yeah,
so much of what happened.
Wow.
my I have two sisters. I have one who's a year younger than me, and she fertile myrtle, no problems. And I have a sister who's 8 years younger than me who had six miscarriages.
Oh, I'm
And
sorry.
she has three kids now. She's fine. She would have a lot of losses and a kid, and we're working through it. And the moment I found out I had celiac, guys, like, you have to get tested. And of course, she has celiac. And cut out gluten and got pregnant immediately with her third baby and no problem. And my middle
It's
sister
crazy.
does not have it, right? And so I think that it is one disease, and I always want to preface that the majority of people do not have celiac, nor is that the underlying cause for most people's unexplained infertility. But it is an example how autoimmune disease, inflammatory disorders are not a traditional part of the workup for this because they are hard to
Right.
diagnose, hard to test, and we have to really be an advocate for our own health if we find ourselves in that position.
Yeah.
Getting well off subject because we could have a whole talk on celiac disease, but
That'll be another podcast.
okay.
So you do a lot of patient education, I'm assuming, in your kind of day-to-day practice, but also, in your online life. But what are the topics that you're most passionate about? What are the topics that feel most important or vital to you? I'm assuming the inflammation piece is one of them.
Yeah, I'll say the first chapter of the fertility formula is how inflammation hijacks your fertility. It's because I just think that so often it's the end of the discussion. And to me, it's on the pathway to every disease state. Infertility is a disease just like others. And it is something that, in the perfect world, this would be something we learn way earlier and we're able to make active choices that are going to support and promote health versus end up harming us. And I think a lot of people view lifestyle just in general as neutral, right? Maybe it could be helpful, but they don't ever really view it as harmful, or they'll acknowledge certain things. Like, we're all okay to say smoking is bad, but God forbid we say alcohol is bad or marijuana is bad, And so it's like we're very, as a society, picking and choosing what information we kind of want to deem as harmful. And it's not that any one thing is going to cure or cause your infertility, but it is the sum of choices that really can be very impactful. So I'm very passionate about talking about inflammation, especially with the context of understanding your own body and lifestyle optimization, all the things that I wish I had known way earlier in my own journey, and things that I hope my patients can know so that they can make the choices that are right for them, especially if they're going through IVF. I think there's sometimes this narrative that you're doing IVF, none of that matters. And I have the opposite view. Like, I think it matters more if you're spending, tens of thousands of dollars, your time, your emotional and physical energy. Gosh, I would want to bring to the table everything I can to have the best chance of success. Besides that, honestly, my other big passion is understanding that how our hormones, our menstrual cycle, egg quality, ovarian reserve, kind of what a foundational reproductive knowledge that I wish everybody learned at a much younger stage, that I feel like most people do not learn until they are trying to get pregnant or have infertility, and trying to really bring that into the broader discussion. Your hormonal health is a vital sign. It's, gosh, as a woman, this is going to be something you are curious about your entire reproductive life. Why are we waiting so long? Why aren't we taught about it?
Yeah.
So those are probably, and those things to me fall into the heading of natural fertility, which I think is so interesting because in my day job, right, I am doing IVF most of the time, and we're talking about, high end things and very specific interventions, because that's where my expertise is so unique from, your OBGYN or other people. So in my day job, I see a lot of people who are at this part of the journey where they need more help. But I say in my personal passion would be, in the perfect world, I wish I saw less people in my day job. I wish more people could get the help they needed earlier and had the information they needed to make choices. And if that could make less people need more aggressive technology, like, that would be amazing. That would never be everybody, right? There are certain things that IVF exists for and is the only thing that will help certain people have children. And it's an amazing, incredible technology. But I think there are some people who always say, if I'd known this information earlier, I would have done something different. And I really would love to get rid of that phrase that I hear so often in clinical practice.
Hmm. I mean, again, so much of what you're saying is resonating with me. But one thing that I'm really struck by when you're talking about natural fertility is the current emphasis on restorative reproductive medicine. And I think one of the many things I found troubling about that is that some of the elements that are talked about there, well, I mean, and I want obviously you to speak to this, but I mean, so many of those elements to me, I feel like are already part of fertility medicine and yet are being framed as something like new and innovative in some way. But and I also think many of them would be extremely helpful. I mean, truly addressing more of the underlying causes of fertility struggles, I think would be universally supported. I think what is so concerning is that it is feeling very deliberately launched as a concept to specifically be against IVF and other fertility treatment rather than, and as you said, like our society just loves little tidbits and little like naming something instead of looking at the full continuum of fertility health and fertility health care and not in this binary like it's either this or that. So could you speak to RRM or just this whole concept in general?
Hey, you really hit the nail on the head here. So there's a few things at play. We have to acknowledge where the fertility industry has contributed to what we are seeing. Is that yes, a lot of the concepts of RRM are not new, but they are also not well spoken about. And who is the person to see to get this help? When do you learn to track your cycle? And who is going to do this evaluation? Because let's be honest, the current role of private equity and many large fertility practices has changed this to some practices are extremely IVF only focused. And so patients are true when they say, but my doctor didn't do that. My doctor didn't tell me that. My doctor didn't work that up. So there's a true problem that the fertility industry can't kind of say that they didn't contribute to. On the other hand, RRM is absolutely being branded as new, shiny, and an alternative to IVF. And I mean, truly, I will rarely tell you I hate something, but I really hate the narrative that they can replace IVF or that if you do RRM, you won't need IVF, that they can cure 100% of infertility, because we know it's false. IVF is such an amazing technology. It's helped 13 million babies be born. This is a place, and I've talked, Dr. Serena Chen and I have talked at length about this. We have met with ASRM about this because there's kind of this war between like ASRM and standard fertility care and RRM. And I think we really need to step back and say, we can acknowledge that even though these things have existed, that there's not a good pathway towards patients learning about them, and more support for that would be incredible. So we've rebranded it as what we call comprehensive fertility care, which is the idea that root cause evaluation, cycle tracking should be promoted earlier, but that as a woman, as a human, as a couple, you should want to have every tool available to you in the tool belt. Meaning, we should not say that we want to do this at the expense of IVF. There is certainly a narrative behind RRM that is anti-IVF, and they are morally or ethically opposed to it, and they would love to see it eliminated or severely restricted. And that should scare you if you are a person, if you're a person, because you should say, gosh, I would hope I don't need that, but if I do need that to have a family, I want to be able to do IVF. And so to me, this is a place where all things that should help patients, we should all be fans of. Cycle tracking, root cause evaluation, more support for endometriosis and fibroid surgery. Yes, but that also includes standard fertility treatments and IVF instead of this one or the other scenario, which is what we are seeing right now. So I think that I see why RRM has come about. I think patients have to understand that what we're seeing is very clickbaity, and that the reason behind a lot of it is to change IVF. And we can all admit that fertility care can be, I'm a huge believer that I don't like the standard of fertility care. I'm going to tell you right now. My big lofty goal with the book is that we completely change how we approach fertility and that we make it more proactive and not reactive. This specialty exists to solve a problem, meaning once you have failed, then you even get testing and an evaluation. And that drives me crazy. Why do you have to fail? Why do you have to go through pregnancy losses first? If you are, you know, me and you say, hey, I am married, I want to have a family one day, why do I have to go through all these hoops and have heartbreak before I'm able to even find out if certain things are wrong? I think that as the rate of infertility increases, which we obviously are seeing, we should reevaluate how we approach fertility, which is a life goal for so many people. And we also have data showing that it's it's also a health marker, meaning people with infertility have higher risk of chronic disease, early mortality, and a lot of that is not infertility causes heart attacks. It's obviously underlying cause, right? Whatever was causing inflammation also puts you at subsequent risk. So I think it's okay to acknowledge as a field that we could reapproach what we're doing. And I think some of the concepts of RM are right on, that people want more information about their cycles, their bodies. They want better cycle tracking. They want root cause evaluation. They want support for that. And they want to, right? But we also need to say, but this anti-IVF piece is a different agenda and it shouldn't be lumped in there. And we really should want, as somebody who's supportive of people and fertility patients, to say, I want it all. I want you to have every tool at your tool belt, and you can get the evaluation and choose what you need. And that's probably going to be different at different stages of life with, different ages and different goals. But we shouldn't ever be trying to completely eliminate an entire option of care for patients.
Yeah. I mean, and another thing that I find troubling, not just about RRM, but about kind of the fertility narrative in general, is a lack of emphasis on the male side. And, like, I feel like there's no references to men at all in most of what I've seen about RRM, which I think is, again, really concerning in terms of the framing of this and the kind of blaming women and focusing only on women, even when they're saying they're trying to help women. It feels kind of creepy. And so there's that piece, which I would
Yeah.
love you to speak just in general about the male fertility piece, but also I think one of the troubling things just about, I feel like, our current climate in this country is a scary lack of focus on actual science and and I find, I mean, there's so many things that scare me right now, but that's one of the things that scares me, because I really realize that, like, I am such a person that trusts science and trusts data. Even when it tells you something you don't want to know, I think we have to accept the fact that data sometimes will tell us something that we don't want to know. But as long as, like, the study is well done and carefully crafted, I want us to trust science. And I'm so scared that we're not doing that. So that
Yeah.
was a lot that I just asked you, but
It's okay. I'll go second first. Kate, it's an interesting world where I never thought that the hardest part of my job would be to get patients to trust that I had their best interest at mind. And unfortunately, that is the current political climate, is people telling the public that doctors have ulterior motives for what they recommend. It's very interesting. I was in a text group with some other physicians who are also on social media, and we were saying, gosh, I could make a ton of money if I just could say whatever I wanted. Poof, this causes that, or do this thing, or buy this thing, right? It's a wild and scary world, and it's got to be very hard to navigate it if you're in the public. I think this is another place where we can acknowledge to people where science lacks in a way that is not paternalistic. The paternalistic prior view of medicine has contributed to where we are, right? Because studies are not perfect. And you are studying one specific research question, we get the answer we can, we apply it where we can. And sometimes we make clinical decisions based on the available research that exists, even if we don't have everything at hand. And I tell patients this, I say, look, they ask a question. I say, honestly, there's been no study done on this, but hypothetically, XYZ, here are the pros, here are the cons. Here's why I think in this choice, I would do this option, and kind of helping people understand how we use evidence to make clinical decisions. However, we've seen, and this will always exist in science because that's what it is. It's a dynamic, evolving field. As our tech gets better, as we have wonderful scientific brains in the community exploring questions in different ways, we will reevaluate prior answers and get different things, right? And so we have like the Women's Health Initiative, which has completely prevented a generation of women from getting hormone replacement therapy, being, currently now, relooked at and kind of have different answers as far as understanding what hormone therapy can and can't do when somebody's in the menopause state. And that makes the public when just presented a flat fact, feel very even distrustful of the research that exists. Therefore, it gives a platform to our friends to stand up and say whatever they want without research that exists. Or what's even scarier to me is this causes this, and we're going to do the science to prove it.
That's not how science works.
That's not how science works, right? Like we can say, I'm worried this causes this. So we are going to dedicate research money to see if this in fact exists or if there's an association. And, I unfortunately, this is that problem I don't think is going to be solved. And I think the solution is going to be as for the public to be very skeptical of who is giving them information and what are their qualifications to give that information, and to have a very high threshold to say like you are you an expert at this, with the idea. I heard Dr. Mike, who's a wonderful science communicator. He's a family physician and he talks about health and has a large YouTube. He said what we're doing to physicians right now is really wild. Imagine if we said, I don't trust pilots to fly the plane, so I'm going to fly the plane. Right? That sounds so crazy bonkers to us. Yet for health and science information, that is really what we're doing. And we're setting this country back quite far. So I think it's hard. I think we do need to say for the public, what are the criteria? What are the qualifications? That can be a hard answer to get. I would say if somebody on social media doesn't tell you their degree or who they are, there's a reason why they're hiding that information. And it's not hard to say you're a fertility expert or a hormone specialist, but we really need to understand what are degrees, what are board certifications, what is this person's expertise, and does that expertise make sense with the information they're giving, right? If like I have a set of expertise that I educate on, and there's times where people will say like, can you comment on this? I'm like, that is out of my, like, I should not comment on that. That is not me. I am not the person to give you advice on that. So I think that's a huge problem. And that problem's getting worse and worse with the current administration. And we just have to acknowledge that. And it's a very scary time for science education in general. The first question you asked is, yeah, it's wild. And you really have to scratch your head saying, why does RRM and why does the administration love women's health so much? And when it comes to different restrictions, yet not men's, when we know that male factors contribute to 50% of infertility, either, alone or combined with female factors. I find that it's the number one change. I mean, I will see every week a couple go through IVF and the woman is doing everything she can. And she is really trying her hardest to, live this clean life and bring the best egg and sperm quality to the table. And her partner is doing whatever he wants. And when we see embryo development stop, when the male genome kicks in at day 3 and we go back and I say, hey, are there lifestyle changes we can make? Or what is happening? That he's using marijuana or in the hot tub or in the sauna or XYZ, and then we make changes and then we see a completely different outcome. And I wish less people went through that. And I think men, not all, but we see a lot of men feel like this isn't their problem, that the society is framing this as a female problem, as an egg problem, so much emphasis on egg and not couples, instead of saying, this is both of you. It's a team sport. It's 50-50. We both need to play a role. I mean, we still at our practice do patient consults virtual, like new patient consults virtual. I mean, all our consults actually. But I will say it has changed my practice to have the male partners present. I mean, any part, no matter, but like we'll say in the heterosexual couple to have male partners present, because what happens very often, especially with in-person appointments, it's hard to get 2 people into your office, different schedules. Female has to be there. Yes, there's more testing that has to be done for the female, but then she hears all this bad news, all this information. Then she is now responsible for going home and remembering it all, telling her partner about it all, having to then kind of answer questions she doesn't know the answers to. And we really are putting our patients center in a really vulnerable, bad position. And when we have both people present, I see that, wow, like eyes are opening. We're a team approach. We both need this test. We both are going to be a part of this lifestyle changes and how we approach everything. And I tell patients this because the time component feels very often like our most valuable commodity if we have infertility. But if you could get an appointment with me tomorrow and your partner can't join. Or you could get an appointment with me in 2 or 3 weeks, but your partner can. Like, you should wait. It changes the course of your journey to be able to do this as a team. It will make your life easier. You will get the support. You will both be able to hear really important, scary sometimes information and make these decisions together. And so I feel like we've really had such a societal and even professional focus on egg and female versus saying this is a team sport and we need both people present.
I love that. And that kind of actually is a nice segue into our two wrap up questions that we like to ask everybody. The first is, what's one thing that you would say to someone just starting to grow their family? So your comment about, it's better to wait and have both partners be there sounds like it
Yes.
definitely fits that bill. But is there anything else you would say to somebody who's just starting off?
I could say so many things. If it's, I think number one, I would love to see more people learn to track their cycle before they start trying to get pregnant. The idea of, I'm just going to stop my contraception and we'll see what happens. I really wish we approached this like, okay, we want to get pregnant soon. So I'm going to now track my cycle. And if there's anything abnormal or red flaggy, go get that evaluated, because I am seeing patients who've been trying for a year because they're told they need to. And then when I, talk to them about their cycles and we see that things aren't normal, we could have intervened a lot earlier. So try to get the data you can for yourself, educate yourself on that. If you want to try soon, learn to track your cycle, use that as a vital sign. And if anything is off, go get an evaluation sooner. I do think when you get an evaluation, both partners be present. And let's add third to this list. I, as a doctor, can only work with the information you give me. Every doctor is going to ask, what brings you in? What is going on? Tell me about this. So spend a moment and think about that before you have a visit. Really, like, how long have you been trying? What are your cycles like? What are your questions? If anything now is different than things used to be, because that is going to make you what we call a better historian. The better you can give me your history, I'm looking for red flags that I can then ask more questions about. And I'm developing my list of the tests we're going to run based on the info you give me. So, really, that, like, let's take an active role in this part of the journey. I want to empower more people to do that.
Oh, I love that. I hope a lot of people listening take that to heart. That's really good advice. Now, this one, it can be kind of from your own personal experience or professional or a little bit of both. But how can somebody show up for a friend or a family member if they share with them that they're struggling?
So, I think make it very easy for somebody to say yes to the help you want to give them. I tell my team this all the time, like, make it easy for me to say yes, meaning problem and a solution. And so when it comes to this, instead of saying, hey, I would love to support you, what can I do? Well, you've now put the burden on me and I have to think of what you can do. And that feels very hard when I'm making 100 other decisions that are all much more overwhelming. So say, I'm going by Starbucks. What can I bring you? Or I'd love to go to dinner. Like, are you free Wednesday night? Or, hey, your next fertility appointment, if your partner can't come, like, I'm happy to drive you and take notes for you. So, like, try to show up with a very concrete thing of what you can do, because that makes it really easy to say, yes, I would love a tea from Starbucks, or, oh my gosh, my partner is out of town and can't go. And I was really scary about that appointment, so make it easy for the person you're trying to support to accept, because it's really hard when you go through infertility to accept help. It feels like a failure, feels like a personal failure when you're going through it. It's hard to ask for what you need. It's hard to know what you need. And it can be very meaningful for somebody to just show up in a way that they can and make it very easy to physically be there.
That's spectacular. I love it. And yeah, you're already juggling so many things. Don't add another, like, okay, now what do I need from people? Like, I don't know what I need. It changes every 10 minutes. What are you
Yeah,
talking
and
about?
it's and then it's hard. What's too big of an I don't know.
Yeah.
Right? So what happens is you end up saying, thanks so much. And then that person never
Like,
is
I'm
actually
okay.
supportive, right? Versus
Yeah.
like a Starbucks cup on your doorstep that says, I'm thinking of you with a heart, like that can really make your whole day. And that's not a big ask. So make it really easy for somebody to say yes, because your people do want to support you. If they haven't been through infertility, they don't know what to do and it's not their fault. But try to think about, if you are that person trying to support somebody else, like, give them something that you can do, and it's an easy yes.
That. Well, thank you so much. This was amazing. And we could talk to you for hours and hours. But we loved having you as a guest on our podcast. Thank you so much. You are the OG of fertility doctors on social media. And I kind of remember when, I've been in this job almost 11 years. So I've seen a lot of change in that decade. And I kind of remember that vibe of like, why would fertility doctors do that? And then I feel like now it's so much more in the fabric of our community in the best way. So someone has to lead the charge. So thank you so much.
Thank you. And thank you guys so much for having me. It's been a heavy topic, but you guys are so easy to talk to, and it's been such a fun conversation.
We hope you'll join us next time for more family building stories and resources. Be sure to subscribe wherever you listen to podcasts to make sure you never miss an episode. And follow us on social media at allpathsfb, or visit our website, allpathsfb.org, for more information about our work. All Paths Family Building is so grateful to the members of our circle of support who are vital to our ability to provide emotional support, education, and advocacy that is open to anyone struggling to grow their families. Today, we want to give a special shout out to our gold sponsor, Ferring Pharmaceuticals. Thank you for joining us for this episode. Please help spread the word so that anyone who is struggling to grow their family can join the conversation. It's an honor to walk with you on your family building journey.